We warmly welcome you, Dr. Maria Nusrat. So today we want to know about the anxiety. What is anxiety exactly? So is the anxiety is the overthinking that we can give it a name that this one is the is the anxiety, or what is this? So over to you, Dr. Maria. So please elaborate this with us so that we can move further. Thank you.
Alaikum assalam, and thank you for inviting me to this show. And first of all, this is a very great and highlighting issue nowadays, anxiety, which is growing day by day in our youth generation. So, as per your question, you asked me, is overthinking is anxiety or just is it is just overthinking and anxiety is something else? Yes, I want to say that anxiety is a big and a very broad term, and we cannot say just a normal tension to anxiety. Overthinking is a personality trait, and it is just a habit, personal habit. We can say that overthinking is a habit. Anyone can overthink in some situations, and anyone can control his overthinking. But anxiety is a proper, we can say it is a disorder, and we diagnose it after a very long duration. When the duration meets and all the criteria meets with the person's problems and the person's symptoms, then we can say that it is an anxiety. But if a person says that I am an overthinker and I overthink on every little bit, a little thing, we cannot say it anxiety.
So, Dr. Maria, these days everyone says, I have anxiety. Has anxiety actually become this common, or are we labeling every kind of stress and tension as anxiety? As we have a questions here from the audience, so we more likely to ask you about the opening question, this one, that like we labeling every kind of stress or tensions, that these are all the anxiety, or what is the actual scenario in all of this?
Actually, anxiety is, as I said earlier, it is a disorder. You want to know about disorder? It is a disorder, which can say it a psychological disorder, and it contains a lot of symptoms, psychological and physical symptoms. When a person faces all these symptoms for a specific period of time, and it hinders their regular routine and daily routine, then we can say that person might need a psychological help, and he's suffering from anxiety.
So a very short question is just come into my mind, that what is like how we can elaborate the terms that stress and tension, like these are the two separate things, or related to anxiety, or these things can create us create any person anxiety in the form of anxiety.
Actually, stress and tension, everybody faces stress and tension in everyday life. We go through from much circumstances. Sometimes we are gone through shortness of money and some troubles in our life, and some behavioral issues of other people, or even mood changes of ourselves, and some hardships of our life. We might stressed out due to that, and we feel tension. But we cannot say it anxiety. If we feel stressed for a very long time, and after that, even stress, no stresses we can found, but after that, even we feel we can feel apprehension and tension after that stresses have gone. Then we can say that might be anxiety has been developed. If a stressor is here, the person feels stress, it means that this is stress, not anxiety.
Yeah, very, very thankful to for this differentiation, and give our audience the very good explanation for better understanding. Now we will move towards the common symptoms, that if someone is experiencing the anxiety, So what do they usually feel in their body and their mind? Like they are like tiredness or something, they are getting some fear or something. What are the warning signs that you should not be ignored?
There are multiple signs, including psychological and emotional signs like irritability, overwhelming and apprehension every time, and not unable to focus on little things, or you can say that state as a condition of doom or aggression and some type of tension, muscle tension, and nerve tension. And a part of that, physical signs are also there. Physical symptom that racing of thoughts, heartbeat racing, palpitations, we can say that, and sweating, trembling, and shaking of legs and arms and hand, and even unconsciousness. A lot of symptoms. When we face all these symptoms all together, and we face again and again these symptoms, then we can say that we should seek the help of professionals.
Yeah, thanks for your nice again explanation for this very common symptoms that you given in very nicely, very briefly in details for our audience. So we are very thankful to you for this. So now we will move toward our cultural side. Like related to our like related to all the stress tensions and all about the anxiety, we can say that we also have the cultural or our environmental issues that we can face in this scenario or something that what you can elaborate for our audience, please.
Cultural, what do you mean by cultural scenarios and
More specifically, we want to, for example, we discuss about the Pakistan. In many Pakistani households, when someone talk about anxiety, people say it's just your head. It's just in your head. Like you are just feeling in your mind. What kind of damage does this mindset cause? Like it's your internal, not any another pressure is coming to the human being, or is there anything is coming from the surroundings also, or the environmental effects is a part of this, or only the internal feelings of the person, I want to say.
actually we can say that sometimes we misunderstand that, sometimes we misinterpret that, but there is a lack of knowledge is also mm, uh, we can say the factor of non underdiagnosis of these disorders. Like mostly people in the houses, they say that this is just a headache, and he want to get rid of all these things. He want to do just rest, so that he's taking them excuses. This is very common sentences everyone faces in their houses. But if a person um, frequently feels these symptoms, and the intensity might maybe triggering day by day, and it may affect their daily routine, then it is not just lame excuses. The person should take professional help.
Yeah. Can you elaborate what type of professional, like they need the sessions or they need some medications like this, or
So contact to the psychologist. After that, he can assess either it is diagnosed, it is an anxiety or some other disorder, or it is just a little overburdened and uh, we can say that compassion fatigue. It is up to the psychologist that he or she will do his or her assessments to the patients, and then they take brief and detailed history from the patients. Then they can make diagnosis that either it is anxiety or any other psychological disorder, or it is nothing.
so Dr. Maria, move to our audience. We got one question from our audience. They asking from uh, UK. They are living in London, and his name is Hamid. He asked me that how do we explain anxiety to our parents or family when they think it's just overthinking or weakness? Because in the recent times, because you already aware of it, but many ancestors will say that no, it's the only you're overwhelming or something, or it's a weakness or something. That how you see as a clinical psychologist, what's your comment related, what's your reputable comment that we can that you can elaborate for to our audience, like the answer of this question, please.
First of all, if you say that our ancestors or our parents, like our elders, are not fully aware of the term anxiety, so that they say that it is just tension and just overthinking. We should psychoeducate them, and we should update their knowledge as well, that this is not just an overthinking. This is a disorder. If someone's life is getting disturbed and he cannot fully perform his or her daily life functioning, so he should seek the medical and professional help, as well as we can also update the knowledge of our elders by showing some videos and showing them some researches about that, and shows them some real life examples of the sick people like facing anxiety. So through this, they can also get aware of this term.
So, like, you want to say that we have to give awareness to our ancestors or our elders, so that no, this is the disease. We have to go to the clinical psychologist or for proper medications, or for go for the spiritual activities.
Yeah, we
Okay.
can enhance our uh, mood, and we can get better our anxiety through medical health and psychiatric and psychological help, along with our enhanced our physical activities, like we can engage in our in different type of relaxation activities and energizing activities, and we can divert our thoughts and mind by engaging ourselves in multiple refreshing activities.
Okay. So now we are going towards our closing of this session, and we are very thankful to you, Dr. Maria, for giving us your precious time, and to give us a very brief description, and give us the also providing us related to the symptoms, related to the spiritual matters, related to the treatment. And the very good question from our audience, he is in the UK, that you already described to us. It's very nice, and we are hoping we will continue these sessions with you, and for our audience, so that they could get more awareness related to the psychology and related to the issues that they are facing in the social era, in the digital era nowadays. So, if you, I would request to our audience now, so that if you or someone you love is going through this, remember you are not alone, and help is already available. So, if this conversation resonated with you, let us know in the comments so we can talk more about it. And please share this with someone who might need to hear it. It could start an important conversation at home. So we will request our audience to take care of your mental health, and mental health is real. Talking about it is the first step. So we have to talk about this issue. Whenever we have to take start whatever we are feeling, whatever we are focusing, or what we are feeling right now or in the future maybe. So very warm thankful to you, Dr. Maria, again, and very warm thanks to our audience who joined us today. And with the next session by the coming Monday, inshallah, the next week, we will surely come up with the new topic that will be also fruitful for you, the best information for you that could save you and your loved ones the for the you can say like the issues that they could face in the future. So very warm thankful to both of you, and thank you so much. The host Tahir Ahmed Khan, and cameraman, our team, remember us in your prayers so that we could proceed and in the better way, to give you the more further uh, uh, details on our different topics. Thank you so much. I would request to Dr. Maria, if you want to
Thank
say
you.
something, let it to our audience in a last minute. So in a very specific statement that they should follow.
I just want to say that everyone should try to relax and calm themselves while handling very minor and little issues, either in their houses, homes, or at their workplaces. It is very necessary to handle everything very consciously and very geniusly. If we mishandle things and we do not use our emotional intelligence while handling these things, we might get suffered by ourselves, and even we can make suffer to others. So it is very crucial to keep ourselves healthy and to remain others healthy. So we should be very conscious while we are talking, while we are contacting or we are communicating with others. We should try that we should not say anything harsh to others. And if anyone say harsh words and harsh things to us, we should relax ourselves and try to forget things and uh, try to get alternative positive things and positive thoughts in our mind to get rid of these negative things, so that
Inshallah.
we can make ourselves healthy and our minds healthy.
Thank you so much. Thank you so much, Dr. Maria. Thanks for joining.
Thank you.